All right. Welcome once again. Welcome everybody to the Youth Veterinarian Initiative. This is our first call for February, our third call for 2022. I think this is going to be our 18th call overall since we have begun this program. And I am very excited to welcome Dr. Mariana Pardo. And I'm going to read a little bit about Mariana so that you will know a little bit about her, who she is and what she does. Dr. Mariana Pardo graduated veterinary school from the Universidad Mayor in Chile in 2009. She works as an ICU technician for 4 years in Miami, Florida, while she was validating her degree in the United States. And she completed 2 emergency and critical care internships at the University of Georgia. So you, Mariana, and you, Susan, need to get together after this call. She was at University of Georgia between 2013 and 2014, and then at the University of Florida between 2014 and 2015. She then went on to pursue her emergency and critical care residency at Cornell between 2015 and 2018. And Mariana is Chile's first and one of Latin America's first female board certified criticalists, which is a person who specializes in emergency medicine and critical care. And I'm going to stop there. I'm going to let you finish telling us about yourself and then let you dive into your presentation, Mariana. So go ahead.
Thank you. So yes, I have like a pretty complicated past of how I got to where I actually am. And I think that growing up, I think the biggest thing that I like to share is that I didn't want to be a vet when I was younger. That was, I know a lot of veterinarians, that is like their dream since they were a little girl. I wanted to be a singer. I love the arts. I wanted to sing. I wanted to be in theater. And that didn't work out for me. My mom really wanted me to be a doctor, and she imagined me in a white coat with my stethoscope and doing medicine. And I rebelled a little bit and decided that instead of human medicine, I wanted to work with animals. I've always loved animals. I just never thought of trying to be a veterinarian at that time. So what ended up happening is that I went to vet school and I realized that this was the place for me. I was so in love with trying to help animals at their worst moment. And in fact, I actually thought that I wanted to do zoo med. So I wanted to be at the zoo. I wanted to work with elephants and monkeys and giraffes, and I wanted to be there dirty and like trying to fix up their enclosures and making sure that their behavior was good and that we were helping with conservation. So trying to increase the number of animals that are at risk right now. And as time passed, I realized that that was a very difficult job for us to get. And going back to my mother, she really wanted me to be in that white coat, which as a zoo doctor, you can imagine that I was dirty all the time. It was not exactly the vision that she had. So I said yes to my mother, and I decided to do an externship just to prove to her that she was wrong. I wanted to do zoo med. And well, mother's always right, isn't she? I ended up falling in love with emergency medicine. So that time that I spent like just shadowing and spending time with those doctors, I realized that I really loved when animals came in like rushing in and they were so sick that they were about to potentially die. And those families were so concerned about these family members and they were so stressed. And for me to be able to come in and save the day and try to bring them back to life and help that family that was going through so much stress, that made me so happy. So I decided to change completely. Like, I'm not going to do zoo med anymore. I did realize I do like exotic animals. I just don't like when they're stable. So I want to try to help them when they're at the sickest point ever. So I still do exotics, and I decided to move all the way from South America all the way up here to the United States so that I could become a specialist. So what does that mean, becoming a specialist? So being a specialist means that you have all this additional training. So I need to go to school for so many more additional years so that I can learn something very specific. And that is specifically emergency and what we call critical care, which is when you're hospitalized and you're very, very sick. So that means that I don't focus on just one body part. Like, for example, ophthalmologists focus only on the eyes, dermatologists focus only on the skin, cardiologists on the heart. I focus on every body part as long as you are very, very sick. So that is what I do. Now, that took a lot of extra years. So I studied for 5 more years after that. I took a big test. And then finally, I was able to become a boarded criticalist, which is what I do. So that means I work at an emergency hospital. And at that emergency hospital, all that I see all day are emergencies that come in through the door. Now, that's all types of different types of emergencies. I can see emergencies that are as simple as someone stubbed their toe and broke their nail and it's bleeding a little bit, or it can be something as traumatic as a patient that was hit by a car and that there's blood everywhere and the family's crying. So we work on all those different types of levels of emergencies when we're in the hospital. Have you guys ever seen any of those emergencies? Have you had any emergencies like that with your pets?
Can come off mute and you know, well, you can raise your hand. We'll have some order here. But I
see some hands back and forth, and that's really good that you haven't needed to go through those experiences. Talia, do you have a question?
One of the emergencies is when my first dog had a seizure disorder.
Yeah. Was that scary for you though? Were you scared? Did you know what was happening?
Kind of.
How many times did your dog seizure?
Hundreds of times.
Oh, wow. Yeah, that can be really, really scary when you go and you see your pet like that because they're not aware of what's happening and they're shaking. I know for sure that when something happens to my own dog, I get super scared and I forget that I'm a vet completely. I need someone else to take care of her. What about over here? I see some hands raised. What questions do you have?
Mariela?
For Mark? There you go.
Can't hear you.
I don't think we can hear you, but you took off the mute.
Yeah. Can you turn your sound up?
No.
No. You want to type your question into the chat?
It's at 100. Do you want to write your question there though? And I can answer it?
Okay, go ahead and type it in. And while we're waiting for her to type it in, Mariana, where is the hospital where you work?
Yeah, so I work for a big company that's called Veterinary Emergency Group, which all that we do is emergency medicine. So we don't see any other cases except for emergencies. I currently work in New York in a place called White Plains, which is just above New York City.
Okay. And how big is the business that you work for? I say business because it is a business, but the company that you work for, oh, here she is. It's not my dog, it's a friend's dog that had a blockage in its throat.
Yeah, so that can be super scary. And one of the other things that we try to do in emergency medicine is try to teach the owners of what to do in these really scary situations. So we get a lot of phone calls of people that are scared or that don't know, is this something that I need to bring to the doctor right away? Or can it wait? Or can I go to my regular veterinarian? What should I do? And situations like that, when there's a blockage in the throat, there may or may not be things that we can try to do at home, but we definitely want to encourage them to come to the hospital as soon as possible so we can try to see what we can do. But there's so many things that we can try to teach the owners how to do at home. So there's even like CPR courses to try to help actual owners how to learn how to do these things so that they can try to help their pets while they're getting or transporting there, or God forbid, they're in the middle of nowhere, or they're in a park, or they don't have a car, or whatever it is, so that they can try to help these animals, try to get them to a better place, or at least until we can get on the phone with them and we can walk them through what the next steps are. So the really cool thing about my hospital is that we have what we call an open hospital. So that means that everyone gets to go in with their pet and they're never separated from their pets, no matter what we do. So you're there for the entire exam. You're there seeing how they take vitals, so they can take a temperature. Do you guys know where they take a temperature in dogs and cats? They take it up their butt. So they put a thermometer up their little butt, and that's how they take it. So this is a large animal thermometer. So it's a lot bigger, but in dogs and cats, they put this, they put it up his little butt, they press the button, and then they see what their temperature is. Then we also take heart rate. So we listen to their heart and their breathing with a stethoscope so that we can count that and see how fast or slow that is. And we can hear lung sounds. So have you ever had a really bad cough and you sound like you're wet inside and gurgly? That's what we're listening for, or like that too, to see how these patients are breathing. So that's what we call an initial triage. So triage means that we are trying to figure out how stable or not you are. So we're always going to see the sickest animals first. And that's what triage means. But the cool thing is that you don't get to leave. So you're there with your pet, and your pet's going to be a little calmer because you're with that animal at all times, holding them, petting them, talking to them, making sure they're okay. And because it's an open hospital, if your pet needs something like, let's say, an endoscopy, which is really cool, you put them to make them sleepy, and then you put a big camera down their throat so you can see into their stomach. For example, if your dog ate one of your toys, we can try to remove it and pull it back, and the owners can see all of that that's happening there. Our surgery suite, which is where we do surgeries, is also full of glass. So the owners, if they want to, they can also watch exactly what we're doing and learn from all these machines that we're using, all of the techniques that we're using with their pets, and they can see how things go. So at no point do they ever need to leave. Sometimes we even have owners that like to spend the night, and we have little beds for them, and they're there to walk their pets or give them medications. And it definitely makes it a better experience for the pets because they're not that scared. Have you guys ever needed to go to the hospital before? Sometimes it's scary if your parents aren't there with you. So that's what we try to prevent, is making sure that our little animals that we're seeing are also as calm as possible, because they don't understand that they're being separated from their parents. So we try to create the most calm environment for them in one of the scariest moments they've ever had. They're so sick, sometimes they're in pain. You broke your big toe. Was your mom there with you though? Or your dad?
Your dad.
Did you feel better because your dad was there? Yeah. Yo, you broke your arm? So that's exactly what we try to do for the pets at the hospital that I work for, is making sure that they're there with their parents. And they know best. They know exactly how they like their food, how they like to be walked, how they like their rubs on their belly or on the back of their ear. So we try to make sure that they're there at all times. Now, the cool thing about emergencies is that I have a lot of fun tools that I can use. So sometimes we can use something like this, which is an ultrasound. So an ultrasound is going to see the inside of your body through what we call sound waves. So it's really cool. So if you've ever researched anything about like dolphins or whales, they send these sounds or sonars and they bounce back, and then they can figure out the shapes of the things that they're looking around in the ocean. This is the same thing that happens with an ultrasound. So you put it on the belly and it sends all of these ultrasonic waves to inside of the belly. They bounce back, and then that creates like a 3D model of what we're seeing on the inside. Now, this is super useful because one, it's very portable, right? So it's really tiny. And two, I don't have to stress out my patients very much by putting them on their side to take an x-ray. It's not very painful. It's very fast to do with the patient right there. So that helps me.
We have a
Go ahead.
question. We have a question.
Yeah.
I've already forgotten how to pronounce your name. Taishe, is it? Want to come off mute?
What if you want to be in a career with animals, but you don't really get to interact with animals, even though you really love them? That is not a problem. So I didn't have a dog growing up until I was 17 years old. So I still loved animals. I still love to read and learn about animals all the time. And like I said, I didn't even know that I wanted to be a veterinarian. So I didn't even have that extra skills of going to volunteer at a hospital. There's nothing wrong for you not having that contact until later when you can decide if this is something that you want to do or not. And then if you don't have animals yourself, you can try to find opportunities to interact with animals. You can try when you're a little older to try to volunteer at a zoo or at an animal hospital or a rescue or a shelter. There's so many different opportunities that you can have so you can increase the amount of interaction that you have with animals. And there's so many different careers within veterinary medicine of things that we can do. So you can be a doctor and be a veterinarian. And that usually means that you're going to learn a lot about how the body works. You're going to be doing diagnostics, so tests, so that we can figure out what's going on with that patient and coming up with the treatments. But you can also be a veterinary technician or a nurse, and they actually implement the treatment plan that the doctor comes up with. So it's a lot more hands-on of being with the animal, giving them the medication, giving the injections, placing the IV catheter so that we can give the medications through the vein. So those two are extremely important things that we can try to do. There's additional things that you can decide to do. You can go into research where you are trying to learn more about these animals. You can decide to do rescue work. You can decide to go into like conservation and try to learn about wildlife and how those animals need to be studied more so that we can try to protect them as much as possible. So there's so many additional things that veterinary medicine is, of different areas that we can grow and do. Even within emergency, I can do emergency surgeries. I can just do the medical part. I can go out on a mobile, like an ambulance, and try to help patients there. I can work in the ICU, which is the most sickest patients. The ICU stands for intensive care unit. So I could work there. There is something called urgent care, which is where it's not as severe as an emergency, but maybe something that's still bothering that pet, but we now don't necessarily need to make an appointment for your vet like in a couple of weeks. So there's so many additional things that can be done in the veterinary field that don't necessarily require you to have a lot of knowledge before you make that decision.
Mariana, can you tell us about the difference between veterinary nursing and veterinary technicians?
Yeah, absolutely. So right now we are trying to figure out what the best terminology, so what words do we need to use to call people a technician or a nurse? And this in part is what, as you go to school, what title they give you when you're done. So some schools give you the title of nurse. Some of them give you the title of technician. Now, technicians have a lot of different jobs to do. So when you're a technician, that means that you get to do part of that nursing care, but you also do a lot of those other things that don't necessarily involve the animal. So you get to run the blood work on the machines. You get to take the x-rays for that patient. You sometimes communicate with the owners of what is going on. So as a technician, your roles are much bigger. But right now, there is some discussions or people are talking about how we should name our veterinary technicians or nurses and decide which is the best word for the job that they are doing right now.
Okay, thanks for that explanation. Does anybody have any questions before Mariana continues? No? Okay. So I wanted to ask a question. So you're talking a lot about small animals with regard to this emergency veterinary practice. Are you ever doing any large animal emergencies?
So I don't do large animal. That being said, my college, the Emergency and Critical Care College, also does have a specialty for large animals. So they do the same that I do, emergency and critical care. They just do that usually mostly on horses or equine. But every now and then they do some cattle or some other larger production-based animals. I have ventilated a cow before. That was very, very valuable. So when we talk about ventilation, it means that we make that animal fall asleep, and then we breathe for them with a machine. So this was a very, very, very expensive little cow that she got pneumonia. She got super, super sick and she couldn't breathe well on her own. So we decided to try to put her on the ventilator so that we could get her through it. And thankfully we were, but it took like 2 weeks of us breathing with her. And it's really hard. Can you imagine if this little cow like pees and poops on her and she's asleep? Need to lift up a lot of weight to try to manage this big cow. Even though she was a baby, she was still very, very heavy. So those are some of the cool things that large animal practitioners do. I do have a question here. How long is vet school in Chile? Yeah, so vet school in Chile, we go from high school, we go straight into the profession of choice that we want to study. So vet school there was 5 years, so we don't have college or undergrad. Most of my prereqs that we would have here are done my first year of vet school. So that's where I have biology, chemistry, physics, etc., all in that first year, involved within the 5 years. And then my very last year is a thesis. So that means that I need to do a research study where I particularly studied a sedation technique with acupuncture. So I was able to put some drugs right here in the middle of the eyes where there's a point called yin tang and see how sleepy they would get. And they did. They got really sleepy. So if you've ever been, for the kids here, have you ever seen like your mom like rub here and you get like really calm and sleepy? That's exactly why. So that point right there is really, really calming. So we injected some drugs to see if maybe a smaller dose of the drug in combination with that point would make them a lot sleepier. And it did. It worked really, really well.
That's very cool. Very, very cool. Are you using acupuncture in your practice today?
Not as frequently as I would want, but there's a lot of things that we can try to do with acupuncture. So one of the big points that I do use for emergency cases is there's a point right in the middle of the nose right here to try to make them breathe a little bit more. So when patients come in, especially little puppies or kittens and they're newborns and they're not breathing, I'll put a tiny little needle right in the middle of their nose, try to turn that a little bit to stimulate them. And sometimes they'll give a big breath and finally start breathing for us. So those are some of the points that I do use. On occasion, I'll use this little point for sedation, but we have pretty good drugs as well that do that function too. And I do refer a lot of clients for acupuncture that have chronic pain too.
Okay.
Now, some of the other really cool things that I do is that I like to see exotic still, right? So I told you guys that that's what I love to do. So I see snakes and I see birds and lots of hamsters and guinea pigs and rabbits that I see. So those are some of the really cool cases that we get to see too, because it's not every day that sometimes you get a snake that was bit by one of the mice that they put in there to eat it. So it has a big laceration and you need to kind of suture it up. So that's always really, really, really cool.
Oh my goodness.
Oh, how does the camera fit in the mouth? Yeah, so the camera is probably like this wide, so it's pretty thin and it moves just as much as this does. And what we do is that with the patient asleep, we put the tube with the camera all the way down into the throat. Now the tube has several little holes. One hole has a light so I can see on the inside because it's dark on the inside of the body. One hole is to suction things out, because if you're going into the stomach, there's a lot of gross gastric juices that we don't like. So we're going to suction those out. And then it has another little hole where I can put down an instrument. And when I put down that tool, those different tools have different little mouths. So some of them are like grabbers, and I can like put it through, and then I'm still looking with my camera so I can put it in, grab whatever is there, and then pull it out. Some of them have just like little cutters. If I want to see some tissue in the stomach that is unhealthy, I can try to take a little piece for what we call a biopsy. Then I can send that out to the lab to see what it is. Sometimes I have some things that are like little nets, like butterfly nets, and they just like open up if I want to grab something and just grab it around and bring it back. So there's tons of different types of tools that we can use, but the tube is not bigger than this, which is really, really cool.
That's amazing. Does anybody else have any questions? I have a question for the young people on the call. So after hearing, oh, go ahead. Go ahead.
Did you have a question? Maybe it was a mistake. Okay, Monique.
I want to ask everybody on the call. So now that you've heard Mariana talk about what she does, and it sounds like just so much fun, how many of you think you might want to do emergency animal medicine? Somebody's typing. Me.
Yeah. You have two there.
All right. All right. All right. Do we have any questions?
I love my job. It is so, so exciting. It's really exhausting sometimes because I'm like running around back and forth, one case, the other case. Sometimes it's a little sad because we can't save every patient. But even when it's sad because I can't save them, I can be for that family there and give them a hug and try to make them feel better about what happened. A lot of people feel guilty and they think it's their fault, and it's usually not their fault. So I'm there to explain that that's not the case and try to help them grieve as much as I can. So I enjoy every part of my job.
That's wonderful.
How many doctors work in my place? So at my hospital, there is 9 doctors that work, and we are open 24/7. So we have usually 1 doctor per shift, and there's 3 shifts a day. So there's a little bit of overlap with a couple of them. And then on the weekend, we have 6 doctors. So 2 doctors on every shift working, which is very helpful. And still we're very busy, but honestly, most of the like big hard work that is done by our nursing staff. So we have a lot of nurses that work in our entire hospital. Between nurses and assistants, we have, I would say, probably like 70 of them that are working all around the clock, trying to make sure that the pets are getting their treatments, that they're comfortable, that they're well fed, that they're being walked, and that they get cuddles, because on any downtime, our nurses are in the cages just making sure that the pets are happy and comfortable. Mm-hmm. Yes, Felix.
So Dr. Mariana, would you agree, because you've said a couple of things that I think it's important for the kids to hear. You said that you are make sure that the owners, the humans, are fine. Sometimes you have to take care of the humans, you have to educate the humans. There's a lot that we do with people. So would you agree that when I say that as a veterinarian, you have to learn to be helpful and a doctor, not just to the animals, but how to take care of people too? And so for people who want to be a veterinarian, it's very important that you know how to have people skills and how to talk to people and how to be nice to people, the same as the animals. Would you think that, do you think that's an accurate way to describe it?
Yes, yes. And that is such a good point to bring up, because a lot of people go into veterinary medicine and they think that they'll never need to deal with people again. And that is very, very much the opposite of what happens. So I see it almost like in human medicine for pediatricians. You deal with that child, but really you're dealing a lot with those parents. And that's what we are doing too. The information that I'm going to have so I can treat that pet comes from those pet parents. How that pet is going to get that treatment is through those pet parents. Trying to explain a treatment or a prognosis, or if things are going to go bad or not, usually involves the whole family structure. So sometimes they won't make a decision on their own because they need to talk to their children or their grandparents or their spouse or someone else in the family. So it is very much a family dynamic. And yes, we are there to treat the medicine of that pet, but really we're treating the entire family group that is being managed there. Because if we don't have buy-in from that family, if we are not sure that they're going to be on board with the treatments that I'm recommending, then it's not going to work out for anyone. So you need to know that going into veterinary medicine, you need to have those people skills. Even in large animals, you may need to treat with the handler or the owner of the place that works there. So whatever it is that you're doing, you're still going to have to be in contact with people. So those people skills are super important. And probably the most important skill is having that empathy. So feeling what the other person is feeling, putting yourselves in their situation, and compassion. So making sure that we're not jumping to conclusions to judge them, and that we're just there to help what's going on at that point.
Okay.
I have another question.
Yep, we have a question from Talia, and then we have Taishe, I think is how it's pronounced. Her hand is up.
Oh, so Talia, what classes should you do well in school to be a vet? So I think the biggest classes that are going to be important are going to be all of those science classes. So I used to think that we don't need a lot of math in veterinary medicine, and that is not true at all. We do math all day. We calculate doses. We think of like the epidemiology of things, if you're doing research. So there's so much math. So any of those sciences are going to be really important to get you there. But a lot of those human resources are going to be important too, as we just discussed. And who else had a question up? Oh, there we go. What's your question?
Can you come off mute? There you go.
I heard that bunnies are very delicate when you're working with them. Is that true?
That is really, really true. So bunnies and any what we call prey animals, so that in the wild, normally they're eaten by other animals. Those usually are very stressed animals in the hospital. Specifically, rabbits, usually anything can stress them out. And when they get stressed, they stop pooping. And if rabbits stop pooping, that is a really big emergency, because you know, rabbits, like they're eating all day. If they're not moving things through their intestines, they can get blocked. And it's a really, really bad tummy ache, and they can even die because of that. So that's a really big emergency. The other big thing that can happen with really stressed bunnies is that they have more vertebrae in their back. So those are all the little bones in your back that make your spine. They have one more of those in your lower back. And that means that if they're wiggling around a lot and you don't know how to handle a rabbit appropriately, they can even break their back very, very easily. So that's why it's really important that when we have pets that are coming in, that these owners call and make sure that we are comfortable seeing them. Just like if someone brings me something for skin, I'm an emergency and critical care doctor. I don't know that much about skin. I need to make sure that the place that I'm taking my pets, that they are comfortable with them. And specifically with exotic animals, not everyone is. So we have a lot of people that call frequently and ask, do you feel comfortable with like sugar gliders? Or do you feel comfortable with an iguana or with birds? And we need to tell them how comfortable we are. Sometimes we're not comfortable with, for example, with miniature pigs. That may not be something that we want to do. We might want to send them to another expert at that point.
Excellent, excellent.
Dr. Mariana, before Talia, the other point I was going to ask you, if you think it's true, they asked, the question was asked a little bit earlier, what courses do you have to take? What do you have to learn? Really what you're describing right now is how important it is to know the normal behavior for animals. That way, it's behaving right or it's not behaving right. Maybe it's sick. It's a prey animal, so I need to be slower and calmer. Did you learn a lot of behavior in school, or did you learn yours in real life at the clinic?
So I learned most of mine in real life. And that's why I think that I don't want to discourage anyone that doesn't have a lot of experience before they get into vet school. Because most of my behavioral training was when I was practicing at the zoo, trying to do that at that point, and things that I started picking up and reading on my own. But it doesn't mean that if you have that knowledge from before, that's great, but it doesn't mean that you can't acquire it later. But it is extremely important that we learn those skills of knowing what behavior a dog looks like when it's scared, when it might be about to bite you, when it's okay to approach them, and knowing that a dog behavior is very different from a cat behavior, from a bird behavior, from a reptile, because the faster that I can recognize those different behaviors, the easier it's going to be for me to know if that patient is sick, of how I need to approach it so it's safe for them and also safe for me and the rest of my staff.
Excellent, excellent. Talia, you have another question.
What can you do for conservation as a kid?
Oh, this is a really good question. So I think that a lot of the things that we can try to do when it comes to conservation when you're younger is to continue to educate yourself as much as possible. So learning and trying to share that knowledge with everyone around you, I think, is one of the best ways of how you can contribute. Now, there are a lot of programs out there that do allow younger people to participate and volunteer. So that is something that is local geographically to where you are, and you can definitely look into those things. But just education is the biggest thing, because once you go into your field of choice, whether that's veterinary medicine or whatever it is, you might be in a position of more power or impact where you can actually do something more about all this knowledge that you've now accrued and you have from when you were younger. Just trying to educate people around you, making sure that for example, and we get this all the time in emergency, that if you see a little baby bird on the grass in springtime, don't pick it up and bring it to me. Leave it there. That is where the mom just left them. It's okay. Learning that, for example, in deer, the mom usually is only with the little deer for a very short period of time during the day. So they leave them alone while they go eat and they get ready, and then they come back kind of in the dusk or dawn of the day. And if you take that little baby away, thinking that it is hurt, there's not a lot that I can do. We're never going to find the mom again. And many of those animals don't do well and then end up being euthanized or put to sleep. So those are really important skills that we learn of what to do, of knowing not to contaminate the waters around us, of making sure that we are not creating more problems in the environment of some of these little creatures. But those are simple things that we can do and educate the people around us so that they're not doing us. Because when springtime comes around, the amount of little baby birds and little baby squirrels that we get, that there's not a lot that we can do, is really hard. But there's a lot of wildlife conservation places that do rehab that I'm sure that you would be able to volunteer and learn a lot more if that is an interest of yours.
Super. Did we have Evie and Mariela? Do y'all have another question? Yes, type it in, because we can't hear you. You guys, you have some great questions. Good grief. Okay.
What if a baby deer gets eaten? Oh, wow. So trauma happens to wildlife all the time. And we do see traumatized or very sick wildlife in the ER. So when that happens, the first thing is for us to make sure, is the patient suffering? If they are suffering and we cannot make them better, the best thing that we can do is to put them to sleep. And I know that sometimes is very shocking or painful for a lot of people, but it's the best thing that we can do to make sure that they're okay if I know that I can't fix it. If I can't fix it, I try to make sure that they're not painful, that they're comfortable, and then I try to set them up with a rehabber. So a wildlife rehab center that can try to either make that patient completely back to be healthy and maybe put them back into the wild, or go to sanctuaries where they can live out the rest of their days, whether we are involving them in some conservation programs or educational programs where people get to come up to these animals and meet them and know more about those species. But it all depends on what's going on with that wildlife when they come in.
Yeah. They typed in, well, the mom is gone, and then wild.
Oh, well. So usually the mom will leave them a little bit hidden in certain places, and then they'll come back to once a day to make sure that they're okay. Bunnies do the same thing. So usually they're only with their little babies for a couple of minutes or an hour at most a day with them, trying to make sure that they're okay. And that's because if you've ever seen Bambi, you know, when he stands up, he's like super clumsy. He can't really walk really well. So the mom doesn't have the luxury of going with their baby everywhere, because that just puts the baby at risk. So just leave the little baby there. They go do their stuff and then they come back when they need to. So what you can do if you're not sure is mark the place, know where that baby's at. Don't touch it. Just look at it, go about your day, come back and make sure, is it still there? Is it okay without touching it? And then you can always call a lot of these places that are rehabbers and ask, like, I saw this little baby bird or this little baby deer or a little bunny, and I don't know what I should do. Should I leave it there or not? And they might ask you some specific questions to know if you should grab that little baby and bring it in, or if you should leave it there. But whenever you're in doubt, unless you're seeing blood or that the patient is not doing well, it's better to just leave wildlife where it is, and then try to find more information later.
We have another question. It was actually sent to me directly, but it says, what if you see an animal in your backyard like a cat, but you don't know where it came from?
So a lot of cats are outdoor cats. So they like to live outside, and then they might still have a home or several homes sometimes when they're kitties. So unless the cat is unhealthy in any way and you're concerned about its health, I would probably just let it be. Now, if you have like an aggressive dog in your backyard and that might be dangerous for them, you could try to like shoo them away. And if the patient, it does look like it's sick, you can try to bring him into an emergency hospital. And if it does have a home, sometimes they'll have a little chip that we inject underneath their skin. And if I scan that, then I can find all the information of the owner and try to find the owners and see if we can find them. That's not always the case. So then at an emergency hospital, we would take care of them, see if they're healthy or not. If they are healthy, we might just send them back home with you and tell them, put him back where he was. He might have a home. And if they're unhealthy, we'll try to do the best to take care of them.
Okay.
Yes, if the babies look sick, I would recommend that you bring them to either an emergency hospital or a rescue, or just try to call the hospital that you're going before and ask them if they do take those animals or not, because not everyone does.
Interesting that you mentioned rescue. Do you work with rescue facilities as an emergency
we do.
hospital?
We work with several rescues in several areas. So what we normally do is we treat a lot of the patients that come in through them, that come in sick, or that they have sometimes traveled even from other countries. We have a rescue that brings a lot of animals from Thailand. And if they're not doing well, they will bring them to us so that we can make them feel better, or make other decisions of what needs to happen with some of these animals. Or we have these pets that come in as strays, and we send them to them once those patients are cleared to be okay. So yes, we work with a lot of rescues.
Okay. All right. Does anybody else have any questions? Yes. How do you pronounce your name? Deline?
Deline.
Deline. Hi, Deline.
Yes, Deline.
I just have something to add about the deer.
Yeah.
When a mama leaves the baby deer, and it could be out in the open, because if she leaves it at nighttime, she doesn't really know where she's, what's the surrounding, but they're never very far away. You may not see that mama, but she's always within earshot. And if that baby cries out, that mama will be right there if she can get there. So I just wanted to add that. I follow a deer rehabber from Buffalo, and she educates very well about everything that she does. And so, what you said about, don't touch the deer and everything, I never knew that. I would have been the first one to call, hey, there's a baby deer, And so she's very educational. And so I just wanted to add that little tidbit for the girls who asked the question, that the mama is, and deer are very powerful. Their legs are very powerful. So if the baby gets into any distress, she will be there to protect her baby.
Thank you.
That's an excellent point. Most of the time, the mom will be nearby for whatever species. They're close by. You just may not see them. So that's a great point.
And I do want to add too, same with cats. You were mentioning, don't pick up baby birds or the baby deer or whatever, but it's same with kittens. If you find kittens and they're not crying, they're snuggled down, they're plump, usually the mama is just out hunting or, away for a bit, and she'll be back to just watch. And before you scoop them up and say, hey, these kittens were abandoned, because if you ever bring in kittens, make sure you bring the mother.
Yes, also a great point.
Okay. We have Mariela and Evie saying that they saw a dog yesterday and it looked clean, but it could have been a stray.
Yeah, we never know sometimes with some of these animals. Animals are also really smart. Sometimes they'll come up to you and almost be like, hey, so I'm lost. I have a collar, like something's going on. And you can try to bring those animals in to find them a home, or for us to try to find their own home if they have a microchip. So I would definitely bring animals in if they are hurt. And if not, just keep your eye on those animals and maybe follow them and see where they're going. Maybe they do have a home and they're just let out to roam on their own. Although very dangerous, I wouldn't recommend to do that with your own pets, but some people do that.
We have another comment from, I know I'm not pronouncing your name correctly, but it's Taishay. She says she saw a whole herd of deer, including baby deer, behind her school fence. Where are you living?
That's also such an exciting thing to see when you get to see baby deer. It's a really special moment, I feel, that we don't always get to experience. So first of all, that's awesome. But as Delene, I think I said that right, Delene said, the mom is usually around. So I would probably just be super excited and feel special that you get to experience that, but still let them be.
Where are you? Where are you geographically?
My school is backing like a reserve full of animals. Sometimes we see deer, sometimes we see vultures, sometimes we see lots of animals. So that was really fun.
That's
wow. Where are you? Where are you? What city or town or whatever?
In Sugar Land, Texas.
Okay.
Not in the city part, but like Sugar Land around Houston. But then there's a bridge, and there's like the Brazos River with lots of animals and stuff. Okay.
I'm from Houston. I remember now, you said you typed up really early in the chat that you're in Sugar Land. This is so great. This is so great. We had Dr. Felix had to leave, and he asked me to say thanks to everybody for coming, and big gracias to Dr. Mariana. Felix is one of our regulars. He's a classmate of mine at Penn Vet, and we go back a really long way. He loves exotic animals also, so I know he loved this whole conversation, and how everybody's chiming in about wanting to understand more about wildlife and how to appropriately approach or not approach, and et cetera. Does anybody else have any questions or anything to say? Yes, Talia. Come off mute.
Your meetings.
Meetings?
Sorry, can you repeat that again?
And do you have future meetings?
When will we have future meetings? We meet every other Saturday at this time. So every other Saturday, 11 a.m. Eastern, 10 a.m. Central, 8 a.m. Pacific. And I am in Paris, France, and we started at 5 p.m. for me. Dr. Susan, do you want to say something? Because we're going to wrap up now.
I think the best thing for the young people here on the call to do is to kind of learn as much as you can about animals, whether it's watching Animal Planet or Discovery or Natural Geographic. There's all sorts of animal programs on there. And so being able to educate yourself that way and then follow up that information by reading about it in books from your library. Because sometimes the information that you get from those shows is really short, and because they need to be on TV for that 30 minutes or the hour. But if you go and read about those animals, you'll learn so much more to make it exciting for you. So finding out about that, and then trying to maybe volunteer at the Humane Society. Can you work at, if you have an aquarium nearby, can you work at the aquarium or the rehab places? A lot of veterinary clinics, until you're a little bit older, will only let you maybe work in the kennel as a teenager, where you get to, walk the dogs and cats, or not walking cats, but well, maybe some cats you can walk, but walking the dogs and cleaning the cat cages and feeding everybody and making sure that they're happy and stuff. To get that experience, just to kind of to foster it, to see, hey, do I really like this or not? Because you don't want to get there and then decide, ooh, this is not what I wanted for that. So those would be my big things to do, is kind of, and see if any of the local colleges have some kind of weekend camp or a summer camp that deals with animals, and convince your parents to let you do that.
Zoos too, a lot of the zoos will have kid programs. So there's all kinds of ways. You just be creative, and you'll find out what you need to know and what you want to know. So Mariana, do you have any last words for us?
No, I just want to say that being a veterinarian is super fulfilling. It makes you feel like you're doing something good for the world. So I very strongly recommend to choose this type of career for your future. It takes a lot of work, and you need to recognize that from before. It's gonna be hard. Mentally, it's a lot of work. Physically, it's a lot of work, and it's a lot of years to get where we are, but it's really, really worth it. So if you at any point ever want to have any questions answered from you from the emergency side, please feel free to reach out. I'm gonna write my email here if any of our participants have any questions.
Excellent, excellent, that's great. And we will definitely share that. Oh, Mariela and Evie say that they have an English Mastiff, and I guess their great grandmother is from Sugarland. Okay, wow. So we have Mariana. So Mariana's email is marianapardodvm@g. Oh, look, marianapardodvm@gmail.com. And someone wrote Paris. Oh, Paris at the moment. Someone's in Paris at the moment.
I think that's where their grandmother is.
Oh, okay. Oh, okay, I get it. I get it. Okay, sorry, not Sugarland, Paris. Okay, fantastic. All right, I want to thank all of you for coming. I definitely want to invite you to come back. Tell your friends, your family, if you've got cousins, sisters, brothers who are interested in vet med or just love animals in general. We're always welcoming you. to come to our calls. And we are planning, if COVID is willing, that we will have a summer camp in August, and we'll be keeping you abreast of that as we go along. Talia has one other thing to say. Yes, Talia.
Will you get an email for future calls?
Yes, if you are on this call, that means you're on a list, and we will send out every time that we have a new call, we send out an announcement and we send out a link so you can register. So you should be able to get that information. Okay. All right. This was super cool. Thank you all for coming again. I'm going to let you go and have a good Saturday. It's evening for me and I've got to go cook dinner.
Goodbye,
Bye
everyone.
for now. Goodbye and thank you. Bye.